Unit 6 Safety, Patient Safety with a focus on Transferring, Lifting, Repositioning, TLR, Medication Errors and Incident Reporting by Brittany, Charlene, Bruno, Leanne, Morgan, Carla, Jennifer, and Matt.
So the overview, we will discuss patient safety and who it affects, TLR, medication administration and incident reporting, goals and actions for each issue, what might happen if patient safety is not addressed, who are the key stakeholders, social and cultural analysis of this issue, and then we will also go into the responsibility of nurses for this issue.
Our objectives: discuss safety issues in nursing, identify and analyze safety issues from a social, political, or economic perspective that exist in nursing practice, and identify your responsibility with respect to creating and fostering a culture of safety.
Where's Waldo? Safety issues. This video is just to get you guys thinking about some of the safety issues that can occur in the hospital. Please pay attention to different aspects of the video that will highlight our topic of medication administration, TLR, and then incident reporting.
Oh, hi.
Hey, here's some meds. Okay, take those.
I'm just gonna check out your IV here, okay? This looks okay. Oh, except the tape's coming off.
I didn't bring any.
Me either. Oh, there's some spare stuff
Oh,
stuck on the
hey.
bed. So good.
I'll look for some more. You have a piece?
Thank you.
Oh, look. Here's the meds from yesterday.
Oh my god, that's so funny. We needed those.
Yeah, we were out. So here,
Let's just reuse them.
take these two.
Just keep all the stuff
Okay.
here. It keeps you warm.
Oh my god.
A spare syringe.
Almost poked myself.
Oh,
Can you
yeah.
imagine?
Alright.
Okay.
Oh my god, is he on isolation?
I didn't think so. I didn't see a sign.
Whoops. Guess we'll find out.
Okay. So we're gonna get you up and put you in the wheelchair, okay?
Okay.
We'll be right back.
Okay, that's as high as it goes.
Perfect.
Totally forgot the wheelchair.
Wheelchair. Okay, we'll be right back, okay? You know, that was bad. You almost poked yourself with that insulin syringe in his room.
That's true. I mean, if I hadn't have found it, then the patient could have gotten poked.
Yeah. Should we do anything about that, do you think?
Yeah, we should probably report it. I think probably go talk to the unit manager.
Yeah, I think you're right.
Okay.
Let's clean up first and
Yeah, I'll
and
put
we'll
this
go.
stuff away and we'll go.
Perfect. What is patient safety and who does it affect? The CNA defines patient safety as the reduction and mitigation of unsafe acts within the healthcare system, as well as through the use of best practice as shown to lead to optimal patient outcomes. This issue of patient safety affects patients who are at the receiving end of healthcare. It also affects patients' family members. There's a significant cost to the patient and the healthcare system when adverse events occur. Any incident that causes an increased length of stay can lead to a myriad of other issues such as nosocomial infections, delirium, and falls. These issues can cost the healthcare system additional money and also have an emotional and physical toll on the patient.
What are some options for action? We chose 3 areas that require action for patient safety: TLR, medication administration, and incident reporting.
What is TLR? According to Saskatchewan Polytechnic, TLR is a course in which students will participate in activities to move and position clients/objects in healthcare settings using minimal physical effort and maximizing the use of mechanical aids and equipment. The course focuses on client/caregiver safety. The use of safe patient handling techniques such as TLR has shown a decrease in the rates of patient and nurse injuries. Despite the evidence that TLR programs significantly reduce workplace injuries, nursing staff continue to manually transfer patients or use TLR incorrectly.
We decided to incorporate some goals and actions for each of the issues we identified in our introduction. Here are the goals and actions for patient safety for TLR. Goal: ensure patient safety through proper education and training on the principles of TLR. Action: offering yearly TLR recertification and having appropriate signage which will positively affect patient safety outcomes. Also, we felt that creating a culture of best practice by commending staff for using proper techniques and equipment and encouraging others to follow proper protocol was also necessary.
What is safe medication administration? Safe medication administration is vital to the nursing role. Nurses are expected to follow 10 rights of medication administration to eliminate the risk of medication errors from occurring. Medication errors are when patients receive the wrong medication or wrong dose of medication while in hospital care. When medication errors result in adverse outcomes, there can be an increased financial cost on the healthcare system. This is from potential increased length of stay and need for additional interventions.
Here is an opportunity for you to review the 10 rights of medication administration. Goals and action for patient safety. Medication administration. Goal: ensure the safe administration of medications using the appropriate 10 rights of medication administration. Action: offer continuing competency training for all staff in regards to appropriate medication administration, establishing a zero-tolerance policy for interruptions during medication preparation, and advocating for adequate space to prepare medications, such as a room devoted to medication.
What is incident reporting? A study found that the practice of open reporting, learning from errors, and instituting a blame-free culture greatly improves the system's ability to reliably deal with risky processes. Incident reporting is not meant to place blame on any one individual. However, it is used to prevent mistakes and help organizations learn from the mistakes that do happen. In Saskatchewan, reporting of critical incidents is mandatory. These critical incidents can be an event that has actually occurred, such as giving a patient the wrong medication, or a near miss, which is when an event almost occurred and could have resulted in patient harm or death.
Goals and actions for patient safety. Incident reporting. Goal: establish a culture of safety instead of the culture of blame in regards to incident reporting. Action: methods for reporting incidents must be fast and efficient for staff so they do not feel it is a burden or time constraint. It must also be confidential to ensure that staff do not feel that they will be stigmatized or judged by coworkers.
What might happen if patient safety issues are not addressed? If the issue of patient safety is not addressed, there is the risk that increased harm to patients will occur. This harm could range from mild, such as ailments and injuries, to severe, such as death. In addition, failure to address patient safety through documentation leads to ineffective monitoring of incidents and difficulty preventing reoccurrence. There is also an increased cost of the healthcare system, emotional, physical cost to patient and/or family, lack of trust in the healthcare system can develop, and the culture of blame is at risk of continuing.
Who are the key stakeholders in resolving this issue? Here we've included a list of the stakeholders that we felt were most important in resolving this issue. We decided to take a social and cultural analysis of the issue of patient safety. The first question in the analysis is what social and cultural factors influence this particular issue? Within some hospital units, a sense of urgency and rush tends to trump doing things the proper way. For example, TLR best practice is often overlooked. Medication error and near-miss reporting is low, as many nurses feel there is a culture of blame. And overall, there tends to be a culture of blame and not a culture of safety within hospitals.
The second question in our social and cultural analysis of patient safety: what are the prevailing attitudes or assumptions in society about this issue? Society expects the highest quality of care. This leads to increased pressure for staff in regards to error and incident reports. There is a fear of punishment for incidents that occur in regards to patient safety.
Here is the third question on social and cultural analysis of patient safety. What values and priorities of the dominant culture influence this issue? In what ways, if any, do these values and priorities privilege the dominant culture over other members of society? We identified the dominant culture to be nurses. In regards to patient safety, nurses perceive themselves to be in a position of power. For example, even though TLR is best practice, nurses often feel as though they know best and will take shortcuts such as manually lifting patients.
Your responsibility: creating a culture of safety. Reagan and Grant state that the focus is on effective systems and teamwork to accomplish the mutual goal of safe, high-quality performance. When something goes wrong, the focus is on what or how rather than who is the problem. It is every nurse's responsibility to ensure patients receive care in the safest environment possible. Nurses are well positioned to promote a culture of patient safety within the workplace. Becoming a nurse leader and promoting a culture of safety is important for the future of the healthcare system and that of nursing. As future nurses, it is important that we understand common patient safety issues, such as TLR, medication administration, and the importance of incident reporting.
Conclusion. Patient safety is a significant issue in nursing. Following the principles of TLR, the 10 rights of medication administration, and completing incident reports are ways in which nurses can ensure a culture of safety. Patient safety needs to be addressed in order to reduce adverse events. From the analysis of patient safety, it was noted that societal norms, assumptions, values, and priorities are what impact the issue of patient safety the most. It is the nurse's role to lead and create a culture of safety.